Welcome, welcome everybody to this very exciting Catalyst seminar on co-production. And we're going to be hearing from two excellent speakers, Rochelle Burgess, who's Associate Professor in Global Health here at UCL, and Malik, who's Director of Wandsworth Community Empowerment Network and also a PhD candidate in Imperial. Rochelle has long been interested in promotion of community approaches to health improvement globally, and she views communities as a route to understanding and responding to political economy of poor health, with a particular emphasis on the impacts of broader development issues such as poverty, gender, racialization, systems of governance, and community mobilization. For the past decades, she's focused largely on mental well-being and the experience of common mental disorders in contexts of adversity. She's a leading voice in the emerging field of social interventions in global mental health, and she has led a range of projects that focus on the development of community mental health interventions in South Africa, Colombia, UK, and Zimbabwe, and has contributed her methodological and mental health expertise to projects on community-led responses to other health challenges, such as child health in Nigeria and patient-centered outcomes for TB. Malik is currently convening the Ethnicity and Mental Health Improvement Project, a cross-sector system-wide partnership to reduce ethnic disparities in access, experience, and outcomes in mental health services, in collaboration with NHS South West London and St George's Mental Health and NHS Trust. This project emerged out of the core work of the Wandsworth Community Empowerment Network that he directs. And this network's job is to address the structural inequalities and systemic racism that leads to discrimination, poverty, and hardship. And it does this by unlocking capabilities of frontline community groups and their members to be agents of change within their own neighborhoods and constituencies. And with this, the loci of power and resources shifting from public institutions into community networks to enable them to be at the forefront of getting early help, intervention, and prevention. And this ground level work in solidarity with community leaders and networks also helps to inform Malik's own PhD studies in the Department of Public Health and Primary Care at Imperial, where he's exploring the role of social network analysis in the generation of relationships and connectivity to improve the operationalization of right-based co-produced healthcare. So I'm sure we will all learn a huge amount from this presentation, and hopefully we'll be able to take some of it when we think about our own work and our own projects. And I am sure Rochelle and Malik will be very happy to answer questions after the talk and probably also offline. I should say that lovely Rochelle is going to drop out very briefly at 1:45 to take her student to PhD Viva, and we wish the student very well, and then she's going to come back and she will be here for the questions. So without further ado, I will pass this over to you, Rochelle and Malik.
Thank you so much, Essi, and to everyone who's taken time out of their day to join us here. My apologies if the screen was moving back and forth. I just had this terrifying feeling that I had not put my computer on Do Not Disturb, and everyone knows what happens with all the notifications that come in. So I just wanted to do that very quickly, just in case you did see things moving around. My apologies. So because we're at a fixed time today, I'm gonna jump right in. Just to say that Malik and I will be splitting this presentation. I'll be talking a little bit about theory, and this is very much the theory behind Malik's praxis and practice working in the mental health inequalities landscape for many, many years. I will let Malik tell you how many years. I won't give that away for him. But we very much united our sort of causes. I'm a researcher who's very interested in mental health inequalities, and I started working with Malik and WCEN about more than 10 years ago, coming up to 13 years, maybe 13 or 14 years. And one of the ways in which we connected was that I was always guided by these sorts of big questions in research and participatory and qualitative research, these big questions that continue to guide me, and they really resonate with the type of sort of activist-informed praxis that I engage, but also the type of like community-led research that and action that Malik is engaged in. And so this idea of starting with this question of who is your research for, and what does your work leave behind? And I think most people can think in the immediacy about who their research is for. Anybody in this room would have a very clear idea of why they've got into research. And what your work leaves behind is always a bit of a question that is a tension that I have found, in the sense that we're able to think temporally in a long-term frame of mind rather than a short-term one. And so I very quickly became dissatisfied with a lot of participatory and even co-produced research because of its inability to really think about things in that long term. So what we're going to talk about today is going to touch on three things. So we're going to talk about co-production as it fits within a wider picture of participatory types of engagement for health improvement and health research. And I think that's important because co-production is very much the hot topic of the day, but participation was the hot topic of the day for many years in many different fields. Community engagement is a mainstay of how we do health. And those approaches have been critiqued for generations of scholars for their inability to actually meet up to their theory. And I think that co-production is probably well on track to be repeating some of those mistakes. And so what I want to talk about today is sort of how that connects and what we can do to avoid that. I'll talk a little bit about the ways in which young people have been involved in research. It's a very brief reflection on a recent systematic review that I think pulls into context what that sort of big problem is around these mistakes of old that we feel that we're replicating. And then I will hand over to Malik for the bulk of the presentation to talk about WCEN and the work that they have been doing over the past 20 or more years to do co-production in a way that is theoretically different than what we see. And I've had the opportunity to sort of document and evaluate that as part of my research work. So if we think about co-production as a methodology or a set of tools and approaches that is sort of interested in working with target communities, that is what puts it so firmly within this lineage of approaches that are linked to participatory research. And participatory research actually, and participatory approaches, has a very long and militant, radical history, though I don't think many people who engage with participatory approaches now would think of them as sort of militant, but they sort of come from a place of resistance in the global South, from pedagogies, emancipatory pedagogies like the work of Paulo Freire, the well-known Brazilian sociologist, and really an interest in how we sort of democratize knowledge. So a big principle and knowledge production. So a big principle at the heart of both co-production and participatory research is this interest in democracy of knowledge and equality and creating sort of an equal platform where people can participate in knowledge production on multiple forms. The idea that research should be a safe space for people who have been historically excluded to participate and generate action on their own terms. And importantly, about this idea of transferring power. So this idea of this sort of emancipatory process where participatory research would be leaving something behind. And so it was a big part of how we thought about development studies for many, many years, and many critiques about how that continued. Of course, challenges emerge when working with communities. And so we often find that across any range of disciplines, so health, politics, education, governance, geographical, regional studies, there are probably different ways of thinking about who your target community is, defining the target community. I think increasingly, if we are giving appropriate attention to this idea and the power of social determinants and socio-political determinants of health, we're moving more towards the acknowledgement of the interaction of these different disciplines. But even in that case, if we were doing a sort of an interdisciplinary approach on the top level, when we talk about communities, it's much less this willingness to be complex as communities are. So we tend to think about communities of place, so these geographical communities, these locations that are bounded by either sort of governance systems and structures, or thinking about communities around identity or characteristics. And here we're talking about diagnostic categories, and sometimes we'll be talking about intersections of identity characteristics. So like we will be talking about today, the BA, Black and minority ethnic communities, and their experiences of mental health. So that's an interactive community already. Communities of shared experience. So we're talking lots in mental health around lived experience. And with young people, we're talking about young people's lived experience of a mental health condition. But then also there are really important communities of practice that we need to consider. So how do different actors mobilize to work together towards a common goal? And as you start to look at the different ways that these things intersect, we realize very quickly that we end up with notions of community that really should look like this. If any one person tries to adapt or work with communities, you are engaging with multiple ideas of spaces, places, groups, and ideas that are both tangible and intangible. And so for me, I think engaging with co-production and engaging with community research actually needs to start with that complexity. So when you're attempting co-production, you have to do work that meets communities where they are. And so a working framework that always been helpful for me, so it's an idea that communities are actually about process as much as they're about anything else. They are about trying to understand the way groups and collectives are talked about and constructed, but most importantly, defended by the people who live in them and come into contact with them, which is a definition popularized in social psychology. Caroline Howarth did a lot of work on that in the 90s and early 2000s. And South African psychologists Sigogo and Modipa talk about the importance of community as a sense of coherence that enables people to make sense of their world and their thought processes. And so really trying to adhere to both the tangible and intangible dimensions of community. And when we don't, we often end up with views on community that from the people within these communities that are being engaged with as quite I think powerful, but also quite telling of the way in which community gets mobilized on the behalf of others. This is a quote that was shared with me during an interview for my book, which came out earlier this month. Greg Beckett is an anthropologist, and he talks about his work in Haiti. And I was asking him about, do people feel that the work in Haiti around health is participatory? And he said, in Haiti, people say that participation means we carry the rocks. And I think this is the result of not approaching community as a dynamic, living, breathing, working entity. We erase local capacity of local actors. We erase local knowledge. And I think that is actually more the norm than we are probably comfortable acknowledging or realizing within many spaces. And I think in research with young people, that very much is still the case, because there is this idea of how we protect young people. And that sort of, I think, still dominates the ways in which we think about the inclusion of young people in health research and research about them. So what I have found really helpful in my work is to constantly center approaches to power in trying to understand how participation within the domains of co-production takes shape. So this is a framework by Susan White. She works in the international development space, and she developed a very, I think, accessible framework to allow us to understand how power works within these approaches. So you go from quite low levels of power within communities, which is nominal forms of participation, where the point is to legitimize your work. You include people, and people want to be included, but the main function of that is for show, because you can't be talking about people without them involved. And so, but they don't really have power of designing questions, things like that. And that extends all the way to this idea of transformative approaches. And the idea of transformative approaches to participation, or as we'll come to co-production, is that the role of agencies is to empower actors to take deep and meaningful ownership over changing their lived realities. But that's also the interest that communities have. Communities are simultaneously interested in leveraging the power that they do have in order to achieve meaningful, both short-term and long-term change in their lives. And so participation becomes both the process through which that happens, but also the end goal. And I want to take us specifically to the topic today to think about how this manifests within research of young people. So this is a systematic review that came out last year. Apologies, there seems to be a helicopter flying above my office today, so hopefully you can still hear me. But co-production research with young people in mental health spaces. And it's a really interesting systematic review. If you haven't come across it yet, please do go and take a look. And what they've done is they've actually done a really deep dive into trying to look at how young people are involved as researchers or as actors within research about mental health. And so they separate co-production, which is supposed to be this idea about more meaningful involvement that approaches this idea of transformation. And then from specific advisory roles. And advisory roles most likely fit into that idea of nominal participation, that quite very minimal amount of like inclusion and functions of participation that I mentioned previously. And so they have this collection of studies that they looked at. Of the full number of studies, which I think was around 25 that met full criteria for inclusion, only 7 involved young people in all stages of research. We're still largely engaging with people who are 16 plus. Only 1 study engaged with children from age 9 to 10. There were mostly studies about mental health services, nothing in there about systems, only 4 with clinical research, 3 public health. And studies went from engaging as little as 2 young people to 115. And the more young people you included, the more it was likely that they were involved in priority setting or brainstorming type activities. Training for young people that was going to have an impact on their lives over the long term was only present in 5 studies. And so what you ultimately see as you look at this review is that at its current state, and this is co-production in sort of high-income countries with young people, is still largely non-transformative notion of involvement. And there's only 2 or 3 studies where you have their involvement in everything, in all stages of the research cycle, from questions, design, funding proposals, prioritization, all the way through to recommendations and action. For the most part, you are having young people present at 1 or 2 levels. And that's where you start to see the real difference, I think, between what we will talk about shortly as the WCEN model, and what more people think about as sort of co-production approaches. So I think quite broadly, when you have not lower levels of participation, you ultimately are doing research on young people. So at any space where you're creating your research questions outside of that community, whether they're directional, whether the final decision about those types of things are happening with researchers in the ownership of researchers, without equal sharing in that process, you sort of end up in those lower levels of participation because there's limited or no interest in power dynamics and the power dynamics between groups and how to enable young people to meaningfully participate. If you move to doing research with communities or with young people, then you start to move into those higher levels of participation because there's an interest in traditional inequalities in power, inequalities in resources. And there is an openness in the entire approach that allows you to move with the voices of people. And so how do you get to a place where that is possible? I think you get to a place where that is possible by setting up your research differently. And so this idea of transformative co-production is this idea of taking co-production to the next level, of actually normalizing the rarity in that systematic review where very few studies are involving young people from the very, very outset of conceptualizing the problem and defining the problem, all the way through to the very end of the life cycle of research about interventions, about systems, about things that involve young people, and thinking about their involvement in ways that is transformative for them. And so what we identified, this sort of theory of transformative co-production, is basically a bottom-up theorization of the lived practice of the WCEN network. So I'll leave Malik to talk about much of this shortly. But the big emphasis here is that transformation is deep. An interest in transformation is really important in spaces where there is a historical inequality between who has been able to speak and who hasn't been able to speak, where you're working to sort of talk about unequal, oppressed, or marginalized groups, because you're entering into a space that carries histories of how people have been researched, how people have been silenced. And those sort of power differentials are long-standing enough so that you have a real challenge in actually allowing people to speak on their own terms, or people feeling safe enough to speak on their own terms. And crucially, in transformative co-production, there is a focus and an emphasis on building safety, building trust, and very critical work that is very rarely operationalized when we think about the success of interventions or the success of participatory and co-produced research. And so the big main things that we sort of learned through this theorization of the WCEN network is that is basically a lot of knowledge that sort of exists in different spaces, so psychological research, international development, sort of thinking about Indigenous knowledge and the power of Indigenous knowledge and Indigenous policy, Indigenous practice, and the importance of acknowledging that when you enter into spaces. The realization that community mobilization, or any mobilization of actors, really depends on the amount of resources you're inputting into that space in the beginning. So that can be material resources, but it's also symbolic and relational. So the importance of recognition, power, being seen to be vulnerable, particularly people who historically and traditionally hold power, being present when sort of people are calling you to account. The importance of acknowledging multiple forms of power within those spaces, and the importance of building trust across these historical boundaries. So this is the model that we presented in our 2021 paper around the WCEN model. And what you'll really notice here that's very different about how a lot of co-production work is talked about is that it sort of extends this idea of co-production across a much longer time frame. So typically you might start in phase 1. So you might start by saying, let's create a co-production network, and you bring key individuals together. But ultimately what we learn and what we see in how WCEN works and what makes their work so successful is that for many, many years, there has been long-term work, and Malik will describe the work, to enable that co-production network to be equal. So work on behalf of community-based organizations and service users, work around statutory services, research actors, that involves time, the importance of repeated dialogue, and a meaningful development of shared goals. And in order to do that, there's lots of different types of power and input happening at different sides, including things like risk-taking on the side of statutory services or big academic systems, but also in the recognition of existing power in communities and trying to bring that to the fore. And it's not until those two pieces come together that you end up with this idea about the different things that co-production does. So you can engage in co-commissioning, co-design, co-delivery, and co-assessment as sort of the different pillars of co-production. But at that stage, as we will see when we talk through the case study, those things have equal meaning for all sides of the network. And so transformative co-production starts with phase 0. So the acknowledgement of power hierarchies, mapping resources, transferring power, bearing witness to historical wrongs, et cetera, et cetera. And so now I will hand over to Malik to talk about what this means in practice. And within that, we will be talking about how the organization moved from meaningful work around adults to its new framework of work with young people, and how this model is working and has been working over the past 5 or 6 years. So Malik, over to you.
Thank you, Rochelle. I'm very pleased to be here. Can I just also acknowledge some other people in the room with us, Gemma Dawson, and I think Tanya Aqua was also in the room. These are very much the colleagues of ours who carry the rocks of much of this work. The Community Empowerment Network is a network of civic society organizations, churches, mosques, temples, community groups, and we've been active in Wandsworth now for about 23 years. So where did our work start? It started with recognizing inequalities. Much more recently, inequalities in terms of mental health services. Some of you will be familiar with this data. This data is not new data. This data has been known by our NHS for the better part of 30 or 40 years. That if you're from Black communities, brown communities, particularly Black, African and Caribbean communities, you are grossly overrepresented, particularly in the acute end of services. Black youths, 10 times more likely to be referred into CAMS services, children mental health services, 2 times more likely for police involvement in your inpatient services. And right at the beginning of that curve, 76% less likely to receive mental health treatment. Next slide, please, Rochelle. And the data is overwhelming. We could mine much more of this data. Black people are 10 times more likely to be detained with a community treatment order, 4 times more likely to be in restrictive practices. I mean, this is gross injustice and a gross abuse of people's civic rights. So that's very much where our work started, is by following the data on what is going on within our public services. So what then began is, as Rochelle described, our phase 0. Phase 0 always starts with building relationships, building connections, understanding the space, building trust, building empathy, building solidarity, building common voice, building common purpose. Hold the date. In a few weeks' time, we're going to have our 15th annual mental health conference. The first conference we held was in 2009. And every year we've been bringing people together in discussion, in partnership, in fellowship. Next slide, Rochelle, please. And of course, in between those 15 years, it hasn't just been the conferences, which are annual events. It's ongoing and daily encounters with people in churches, round tables, with people in decision-making spaces, in community spaces, Black, brown, white people, civic leaders, community activists, young people. It's a constant process of community engagement and fellowship, a constant process of movement building, of emerging knowledge, of emerging praxis from the work that we do. Next slide, please. All of that leads somewhere. It's not just talking for the sake of talking. It's not just, let's just come together and have conversations and have conversations. All of this leads to meaningful interventions, interventions that then make a difference in people's lives. Because the important part of this work is not just talking about the work, but actually doing the work and making a difference. So our conversations, our work has led to the development of co-production networks. And as Rochelle then explained earlier on, then the co-commissioning, co-design and co-delivery, co-ownership of the work. Next slide, please, Rochelle. 13 years in, at our conference in 2019, we achieved a breakthrough whereby the chief executive of the local mental health trust realized that actually we weren't going to go away, and he has a legal and statutory responsibility to address the issues that we were tabling. And we launched what we call the Ethnicity and Mental Health Improvement Project. So what is this project? Next slide, Michelle, please. MHIP. So what MHIP is, it's a partnership between the Community Network and also with South West London NHS and the local mental health trust. It's a clinically led partnership, and it's about practical local interventions and interventions that impact right across the mental health pathway. If you look at the evidence that we showed earlier on, if you're Black and brown and from those communities, you're impacted on every part of the spectrum, from access to inpatient care to experiences to outpatients. So what was important, that if we're going to improve mental health equalities and better services for people, that you impact on the whole system and not just part of the system. Next slide, please. I won't dwell too much on this, but MIP is a program of about 8 interventions across the whole system, from key intervention 1, community hubs, to reducing restrictive practices on wards, to ensuring a culturally capable workforce. So these projects are now live. The ones that you see in red are the ones that are live and currently active and currently being co-produced and co-implemented by communities. And they're all being done inside community networks. So here's just a very brief snapshot. Community organizations where people associate. People are not in GP surgeries. People are not in hospitals. People are in local community groups and association. People are in coffee shops, in hairdressers. People are on football pitches. So the network, held by significant community institutions where people go in numbers every week, all the work that we're doing is co-produced through these community and civic society organizations. So a map of Wandsworth will look something like this. So this is Wandsworth. Wandsworth is a typical borough. London has 33 boroughs. All the boroughs look exactly the same. Next slide, Rochelle, please. We'll just skip through the next slide, I think, but it's just kind of an indication of the kind of relationships that we've needed in order to address this. So what are the implications? Sorry, Rochelle, I can just go back. Yeah, so what are the implications and outcomes for community mental health services when you do it in a co-produced way? Of course, respectful care. People get what they want, when they want, in the ways that they want it. Communities own the responses. So they have a stake in how these services are developed. Recognition that it's local people in local spaces who have the culture, the knowledge, and the lived experience to inform this. And each intervention will be specific and negotiated in the places that they are. If you're Black and you come from Ghana, or if you're brown and you come from Pakistan, if you're a Catholic from Brazil, all of these have different nuances. So therefore the interventions have to be negotiated in these spaces. As we started to do this work, we were alerted to the fact that by the time you're in adult mental health services, it's actually too late. The antecedents of poor mental health actually start at a much earlier age, 6, 7, 8, and 9. Definitely 12, 13, 14. I just want to draw your eye to the, on my left-hand side, the blue-collared data. This is data from Wandsworth Children's Social Care. And this will be the same in most of the boroughs. If you look at the line that says Black on the left-hand side, on every single indicator, it is Black children from Caribbean and African backgrounds that are overrepresented in acute services. Next slide, please, Rochelle. And not just in social care, right across the spectrum, from free school meals, all the way through social care interventions, all the way to youth offending. If you are from a Black community, you are at risk of being excluded, marginalized, labeled, and disposed of by a system that is not designed and not equipped to look after you, as the data tells you. Follow the data. The data is telling you that if you're from a Black and brown community, if you're a Black and brown child, you are at risk of the systems that are surrounding us. So what did we do learning from our adult work? We went back to phase 0. We went back to the starting point. And the starting point is constant engagement, bringing together young people in the spaces that they associate. This picture there of a church, other spaces of the youth club, spaces where young people already come together. Bring them together for them to talk about the things that impact on them. Next slide, please, Rochelle. Again, just like with our adult work, phase 0, bring everybody together, academics, researchers, moms, dads, brothers, service providers, service recipients, in a constant dialogue and a constant negotiation of the space that we are in. We held our first conference in 2018. The last conference we had was just the start of this year. Next slide, please. What was important about this conference, and it's just some snapshot, it's young people themselves who are holding that space. Not researchers, not service providers, not even the parents. It's young people themselves. It's a trust in young people that you are able to tell your own stories and that we believe your stories. What you're saying, we believe you. So this conference is young persons led, and these are some of the solutions. Again, you might not see this slide. I'm sure we'll send out the slide pack. These are young people who ran these workshops. These are their own workshops. Black boys and trauma, education and well-being, domestic and emotional abuse in the community and in the homes. They led these workshops, they organized these workshops, they developed the notes and analysis from these workshops themselves. People like myself and others, we were there to witness and to stand alongside. Next slide, please, Rochelle. Young people also came up with recommendations, and this is really very, very important. And again, we won't be able to go through all of this. We'll send it in the slides. My company secretary in my organization says that we are capable of walking and chewing gum at the same time. Young people, adults, but we're talking about young people here, young people are able and capable to think of the complexities and the nuances of what they need and what they require. We want regular forums. We want a redistribution of power and resources. We want frontline investment in community organizations. We want a greater redistribution of how protection and safeguarding of children works. We want longer term plans. These are all emerging from young people themselves. So as we move through the phases, phase 1 is actually starting to do the co-production. This is in Wandsworth Town Hall with the mayor. This is young people holding the space themselves, holding public agencies to account, the ones who are generating that data, and saying, these are the things we want you to work with us on our terms. Next slide, please. This is inside Springfield Hospital, the Mental Health Trust. Again, the work then generates the organizations to come meet young people halfway. Because what we now have is we have greater distribution of power. Young people are now able to hold the space and hold agencies to account. And that picture there on the left-hand side, that's the chief executive of the Mental Health Trust and the medical director, who are now being brought into a space that young people hold. Next slide, please. So where are we now? Where are we now? 15 years of our adult work, 5 years of our children's work. To a large extent, that has pushed the local system. Wandsworth Mental Health Needs Assessment, as one of its priorities, it says improving mental health and support for ethnic minority children, young people through culturally adapted co-produced evidence. And the ICP, the local health system, one of its core priority funds is supporting the health and care needs of children and young people. We have only got to this space because young people have mobilized. So the time is now for us to do this. There is a call for action, and we look forward very much to the discussion and how very much you can be part of these conversations along with us. Thank you, Rochelle.
Thank you, Malik. It's amazing. And just to very quickly wrap up and then open the floor to discussion. I think what we can mostly take away from Malik's sort of talk about theory in reality or praxis is that transformative co-production allows you to do so much more in terms of, I suppose, laying the appropriate foundation for systems and interventions to thrive and for more meaningful encounters between people who experience interventions and services and the people who are sort of in the spaces that they are to design them. And I think that that is an ideal. That's very much an ideal. And I think that in the talk, Essi, I'm sure we'll mention, you know, some of this tension in how we get there, because our current funding mechanisms don't very recognize the importance of that groundwork. But I think there are other ways in which we can start to approximate and sort of build that into our existing projects and our existing systems. And so this table, which is again sort of adapted from some of my earlier work, connects to this idea. So like, at a bare minimum, what are we doing? We're sort of doing participatory methods. We're thinking about compensation. We're openly reflecting with communities on the transferability of outcomes. And we're doing that in ways that hopefully are about building long-term relationships with organizations that can exist outside of the bounds of funding. You know, Malik and I have been working together for a really long time, and I think the amount of work that we have had funded doesn't equate to the amount of time that we work. So it's about sort of building really long-term relationships with the actors in sort of communities that matter to your work. And then increasingly the funding landscape is a bit more in the middle. So talking about co-design, co-production about specific aspects and specific practices. And I think that if we start to sort of collectively move towards this idea of transformation and normalizing it, we'll be in a much better place for making sure that child and young people's mental health services are appropriately responsive to the complexity of their lives, because we will be being led by them rather than us. So I'll stop there. And to say that we're open for questions. I'm also now stepping out to take my student over. She's arrived. So I'm sure most of the questions / all of the questions can be answered by Malik, but I will be back hopefully in a few minutes time. I know we wrap up at 1:15. So Essi, I'll hand over, and thanks very much everyone for your attention.
Thank you hugely, both Rochelle and Malik. That was just a real tour de force, and I'm sure will generate a huge amount of discussions. I would really like to encourage people to either put their questions or discussion points into the chat, or if they're feeling particularly brave, and I encourage people to be brave, put their hands up using the hand function, and then we can kind of referee questions that way. Perhaps I can start, as people are thinking, with one question. So I noticed that you had very, you were able to mobilize the young people in a really impressive way, going to the community level, but you also had senior leadership from the trust involved and engaged. And I know that before we started this session, we had a little chat, and you were talking about this importance of kind of co-production at all levels, including the agencies that hold kind of funding and power and policy making. So I'm would be really interested to hear a little bit more just about practically how you went about engaging these different entities.
Thank you, Essi. I think with young people, it was far easier. Our community empowerment network is embedded inside spaces and places where young people are. So our network members are community groups, church groups, neighborhood groups, community networks, youth clubs. So young people and families are easily accessible to us because we are embedded in my home office is on a very large housing estate. I have 3 youth clubs that are within a stone's throw of where we are. So that was relatively easy to do. Now, the groups that are hard to reach and difficult to engage with are our public agencies and their leadership. Very much they are only accountable to themselves. They mark their own homework. If any of us attend public agency meetings, actually the only people in public agency meetings are other public agencies. Now, how we brought them to the table is through power, is these public agencies are, and the key word in public agency is public. They are responsible for public funds and are publicly accountable. So our network has civic leaders in there. We work with councillors, MPs, bishops, imams, taxpayers, active citizens. And by mobilizing local community assets, it dragged the public agencies to the table because they recognize they are accountable to these people. So by building the network, hence why Essi, it's taken 20 years, because we've had to mobilize communities and mobilize power. So they've come to the table to a large extent, kicking and screaming, not willingly, because the data has been known to them for 30 or 40 years. They've come to the table because the Community Empowerment Network has strength and it has power of citizen activism.
That's really, really, really brilliant. Thank you, Malik. There's a question from Nikki, and then there's another one from the chat that I will take after Nikki's question. But Nikki, are you happy to unmute?
Yes, hi, my name's Nikki. I remember earlier on, someone mentioned most of the young people you work with are 16 plus. I was just wondering, will you be looking to lower this age, as when you turn 16, you move from children's services to adult services, so the impact that these young people have, the input they work with, won't actually have a huge effect on their mental health because they won't be able to tap into the services they help change.
Thank you, Nikki. That's a very, very important question. I suppose as an independent community organisation, as soon as we start to get below the age of 16, there is a different set of safeguarding procedures and requirements that we have to follow that then makes it a bit more difficult to work in that space. But the good news is that we work very closely with schools. We work very closely and will be working very closely with the mental health, the CAM service, the Children's Mental Health Services. And it's in these places where young people are. I mean, young people are in schools. By and large, they're in schools. And young people in need are in our CAM services, in our youth offending services. So a lot of the work in terms of co-production, it's not just co-production with community groups, it's also co-production with the agencies that are responsible for children's safeguarding, who have a much more robust governance structure to work with young people. And you're absolutely right. We've got to get in at 8, 9, 10, 11. And the way to do that is through the institutions that are working with this community.
That's great. There's a question from the chat. And this is again something we were chatting about a little bit beforehand. How do you set the appropriate level of compensation for young people, young adults you're engaging with in co-production? I think this compensation more broadly is sort of a hot topic in co-production research. You know, how do you ensure that you are fair, but you don't over incentivize and so forth?
So we started off by vouchers. So we buy vouchers. You know, there's also the kind of tension about paying people under the age of 16 and all of those kind of safeguarding issues. So we've always paid in vouchers, food vouchers, entertainment vouchers, gift vouchers. But we recognize, Essi, that vouchers by themselves is not going to get you very far. And especially some of our older young people who are actually young adults, there needs, you know, I'm being paid to sit in the room and they should be paid to sit in the room in order to equalize power. So what has happened much more recently is that we as a network have dipped into our reserves, which is not a lot, it's our charitable funds, in order to pay young people. What we do is we pay the London living wage, which I think, if I'm not mistaken, is £12 something. So we don't pay a child rate, if there was such a thing. We pay the London living wage in respect of our fellow citizens. So if we do engage with young people, it's at that rate. And we engage with them usually on a sessional basis, 5 hours, 3 hours, 2 hours, 8 hours, because we also recognize that young people being young people are at the start of their lives. So they're going to have all kind of other really interesting things to do: college, school, work, social networks, friends. So we don't really impinge on that. In fact, we encourage them to actually live their lives and be their best selves. So that's how we try to balance it. Vouchers sometimes, London living wage sometimes, and actually dipping into our own financial resources. I think there's a big need, Essi, for public agencies to recognize this and to step up and to use some of our public funds to do this, but I don't think we're there yet.
Yeah, I think this is something that Rochelle and I have talked about a lot, and a number of other colleagues as well, that quite understandably, increasingly research councils and other research funders want there to be co-production. I want it to be at the stage where the grant submission is happening or funding submission is happening, yet there isn't currently any sort of universal or sustained route for people to obtain funds. So this creates this interesting dynamic where possibly richer institutions, PIs with some slush funds can do this properly, and then other people can't. So I think that there is something that we ought to work together with maybe foundations such as McPin and also these research councils and charities to think about how this sort of model of having a trust building and having a kind of a co-production model that is not just response mode and not just consultative could come about.
Can I say, Essi, what's also important here is that, young people, just like with us adults, know how to behave. So the thing is that once we start paying young people, and we have done and we do, we then end up in a relationship of obligations and duties. We will do this, you will do that, we will do this, and you will do that. And young people will step up to it. They will step up, they will participate, and they will actively engage in that process. They will stick to the contractual arrangement that we have. It's good for them, it's good for us, it builds good habits, it builds obligations, it builds duties, it builds responsibilities. So I think we need to go much more in that way and redistribute resources.
Yeah. Are there any other questions in the either from the chat or from hands being put up? I have a kind of a question which I'm always sort of challenged, and I'd be interested to hear your thoughts on this, which is when you're talking about co-production and the kind of work that you've done, this has very much been in the kind of applied space, and it's been less perhaps about research, as in more about research about what produces sort of good co-production. Now, I can think of very different types of mental health relevant projects, which might require different kind of co-production. And I am wondering whether the full empowered model is actually something that is necessarily even possible for some types of research. So if we think about some incredibly specialized neuroscience research, basic research with relevance for mental health, but where you need to actually have quite a bit of training to understand the methods and all the rest of it. I am not sure whether it's possible to reach a truly, we can probably do better than we've done, but whether it's realistic, if people haven't had training in the area, to have quite the same level of full participatory model as it might be about questions that relate to, for instance, provision of existing mental health care. So I am forever sort of struggling with the lack of, I feel, good guidance on this realm. And I'm not expecting you to kind of provide it in this meeting, but I'm wondering whether you think that we actually need some kind of a meeting and perhaps produce something that is a statement piece as to, okay, what sort of co-production should we expect with regard to what types of questions? And that's not to say that people shouldn't be involved from the first stages in all types of projects, but to what extent, in what capacity? I think those are, to me, kind of questions that I don't think we have probably spent enough time thinking about, and would be interested to hear from both of you. But there are also, I think, some other things in the chat, so I don't want to monopolize this.
Very quickly, Essi, I think you raised some very, very important questions. For me, very much in the work that we do with public agencies, and not just our local trust, with a number of public agencies, I think it comes down to power and control. Institutions have a lot of egotistical power and control. In fact, they have very, very punitive powers. They can strip people of their liberties. This is serious business. They can detain people, and often for years. So I think there's a culture of power and control and a tendency to lessen the opportunity for co-production. My own sense is that we can co-produce unless people are psychotically ill and need to have clinical statutory support. I think almost everything else can be genuinely co-produced, if not with the patient themselves, but definitely with the patient's carers and families, of which the patient's voice would be central. I think the reason that why we don't go down that road or effectively go down that road is because our institutions don't want to let go of the power and control they have over their institutional mechanisms, over the power and control they have over people. I think this is a much wider conversation around structures and systems, and how such structures and systems are used to manage and coerce peoples. But I think that's another conversation.
I think there's, but maybe we'll organize an event at some point. There are a few questions in the chat, and there are some hands up as well. We only have 15 minutes, so I'm going to try and do this as fairly as possible. So there's a question about whether you've seen or predict changes in your co-production approaches and strategies in response to cultural differences and dynamics in how young people are supposed to engage in communities or question authorities. And you know, perhaps I don't know, Rochelle, if you want to speak to this, as you've worked in a number of different countries. I don't know if is Rochelle there. Maybe she's not back yet.
I think in the absence of Rochelle for the moment, I think the answer is yes. We have to change and we have to adapt. Culture is not just in terms of young people, but you know, a young Ghanaian boy is going to have a different experience to a young Nigerian boy. And their culture, their family, their background is all going to mitigate the different types of co-production we do and the different kind of feedback we receive. But my sense is, Essi, that it all starts with trust. And I can go further, and I can talk about love, and I can talk about fellowship, and an arm around the shoulder, and hugging people, and looking after people, and caring for people. And I think that once you connect with people from the heart, genuinely from the heart, I think all the other things strip away, and it then becomes a much more meaningful relationship that allows for a lot of change to happen. I think because we don't have trust is why we then have to start to get into these different kind of mitigating processes.
There's a sort of two somewhat related, I'm going to take this sort of trying to group the questions, two somewhat related questions in the chat. One is from a PhD student who's saying, okay, well, how do you incorporate co-production when you have a 3-year PhD, which may be a sort of standalone project? And then somewhat related question is, when you apply for grants, there are very short timeframes for these grant calls. So there's no way you can do the kind of co-production that you are engaging with in there. So, you know, what are yours and Rochelle's thoughts around, you know, is this just something that we actually need to think about to be more kind of creative in how we do? Do we use people we already have relationships with, and then you don't establish something from the start? What are you thinking of? How do you fit this with sort of the realities of people's sort of research life cycles and projects that, you know, I think it's unrealistic to expect that our kind of mode for applying for grants is going to change. So that's going to be response mode. So how does that sort of fit?
I think Rochelle would probably have much more better answers in this than I would. But I think it would be to partner with organizations who are very much already in the field. I mean, when I met Rochelle probably 15 years ago, is that a lot of the carrying of the rocks we did at the Community Empowerment Network, because we're already in that space. So I don't think that it's realistic to expect PhD or other students just to kind of do co-production from scratch. But actually to identify, build relationships with organizations who are already in that space, who already have the relationships, who are already in that environment, and to try to partner with them in order to emerge the research that's necessary. That fast tracks it within a shorter period of time. We're now doing work in other boroughs, which we can do much quicker than the 20 years in Wandsworth, because we're partnering with organizations who have already done the heavy lifting before us.
Great, that's really helpful. Gemma, do you want to ask your question at this point?
Yeah, hi everybody. My name's Gemma Dawson, and I work for South West London integrated care system, or previously the clinical commissioning groups, and have been working alongside Malik in the MHIT program. So it's really fantastic to hear the presentations today and be part of it. And I guess I just wanted to underline a couple of points that Malik was making, and some of the questions that I think really, actually, it's from my experience and what I've observed at WCN have supported in developing the MHIT program, is that the question is less about, will young people want to, or how, or what. It's more about also a different set of questions to statutory partners about whether they have the genuine inclination to support this kind of co-production. And I think it's about perhaps surfacing some of the hidden taboo topics that actually it suits a lot of our statutory organisations to do more of a consultative or more of the other types of co-production that was at the sort of front end of that table that Rochelle shared, that's quicker, that retains a lot of the power and the resources and the distribution, and it's far easier to do that than something else, and that actually, therefore, what follows is there isn't the appropriate training, there isn't the appropriate resources, there isn't the collective or the conceptual understanding of what co-production really is, and therefore you get absolute prevalence across the statutory system of making decisions on behalf of groups without them there. So the question is, the real challenge is, how do you turn that culture change around so that they can genuinely understand that, and particularly from organisations that think they are doing it. So more of a statement, I guess, more of a different question to ask, perhaps not for being answered.
Yeah, thanks, Gemma. That's really, really helpful. I'm going to take a few from the chat because, Nikki, we've heard from you, so I'm going to come back to you if we have time, but I'm just trying to give everybody a chance. So there's a question whether there is sort of a move towards using the voices of young people and service users to work alongside professionals to change healthcare services and approaches to care. Malik, I'm assuming your view, this is at least happening in some places, but...
I mean, the simple answer to Kevin's question is yes. I mean, we're talking about co-delivery, co-design, co-implementation. Young people themselves being trained, mentored, coached to come into the workforce, and for us to redefine what the workforce is. The workforce is not just professional actors in institutions, it's also young people in social networks. What is the governance structure around that? What is the contractual structure around that? What are the outputs and the outcomes we want to achieve from that type of reimagining of what an early intervention prevention health system looks like for adults and young people? We're beginning to do some of that. We have some live projects up. We've created employment opportunities already. I think, Kevin, that is the direction of travel, about how do we reimagine what the professional workforce looks like. Excellent question, and I think a direction of travel.
Thank you. There's a question from Kerry Wong, which is, what can we do for those most in need of support who are not in the schools or youth clubs or in help-seeking spaces?
See, Kerry, I think that with all respect, this question is often a red herring, because we are not even working with the people who are in touch with young people, let alone the people we are not in touch with. Our statutory systems are not working effectively with schools. Schools have become very much a kind of very limited economic space, as opposed to a genuine space of young people's well-being. Youth clubs are not connected at all. Most civic society organizations are not connected with public services. So I think it's an important point. There's a lot of young people who are not connected to these spaces and places. But my response to this question is that we are not even working with the known knowns, let alone the known unknowns. In a typical borough, Essi, like Wandsworth, there's probably 1,000 civic society organizations. At least 300, 250 will be around young people. We are probably working with 2 or 3 of them. So therefore, the thing is that we're not even working with the known knowns, let alone the unknown unknowns. And once we start working with the known knowns, they are the ones who are probably nearer to the unknown unknowns than we could ever be.
Very good, thank you. There's a question of if program is to be classified as the kind of community-based participatory research, is it possible to shift co-production to co-creation, and how? And can you sort of elaborate on that? I think we probably touched on it a little bit, but if you want to say anything further.
Well, my sense is that it's all the same thing. Whether it's co-production, co-delivery, co-creation, co-implementation, actually it's about shifting power and resources to communities and enabling communities to be the change they want to be within their own neighborhoods and communities. Now, whether we call that co-design, co-implementation, co-production, it doesn't really matter. What matters is the shifting of power and resources. That's what matters. Because once you shift power and resources and enable citizens to become active in their own spaces, they will then design, implement, produce, evaluate, and own.
Can I ask, as part of this, sort of, what are the sort of usual structures that you have for then evaluating that this sort of shift is, because presumably there needs to be accountability. Even within those communities, there are presumably power structures within them. You go to community leaders, you don't, you know. So how do you work with that in your work?
Well, this is where brilliant people like you, Essi, and Rochelle come in. Because when Rochelle came into our space, essentially what she undertook was grounded research. So actually to observe and understand what was going on, and then to build a framework around that or place it within a framework. So if you look at Rochelle's research on our work, and we are constantly evaluating our work all the time, there are academic research tools to do this. But the thing is not to start with a kind of fixed framework, but to actually be grounded. I mean, I'm a huge fan of grounded research. Well, actually to listen to the voices that people are already saying and fit that into the process. So everything that we're doing is evaluated. It's either evaluated internally through QI processes, quality improvement processes, where we have theories of change and model it around theories of change and outcomes we want, or external evaluations. We're in the process at the moment with Gemma of commissioning a very large evaluation of MHIP. So there are processes, there are techniques, and I think Rochelle has explained some of that in her presentation and her work.
Great. Nikki, do you still have a question? You had a hand up a while back, but no, that's gone. Okay. Any further questions at this point? If there aren't any, I think this is probably a good time to thank our speakers for a really thought-provoking and informative presentation. And I think hopefully this will catalyze further sort of maybe meetings that we can organize around this space. So thank you. And there are details about the next Catalyst seminar in the chat if anyone is interested. Malik, did you have any point to raise at this point?
Yeah, just a final point. I think some people said in the chat that saying, how can you get in contact with us? We are always looking for friends, fellow travelers, fellow researchers, activists, thinkers to come be part of the work that we're doing. And I'm sure afterwards we could share some details at Malik Gul on Twitter, or as we now call it, X, at Malik Gul. If anybody wants to contact me, or you could find me through Community Empowerment Network. We welcome participation and support and community and solidarity.
Brilliant. Thank you so much, both Malik and Rochelle. And thank you all of you for coming and for really, really lively discussion. And if there are any further questions to Malik or to me or to Rochelle, please maybe drop a line. Certainly Rochelle and I, we're Googleable, so you can get in touch. Okay, thank you.
Thank you.